Hi, and welcome to this special episode of the Disaster Podcast. I'm Jamie Davis, the Pod Medic. We're here at NACCHO's Preparedness Summit in Atlanta, Georgia, and we're going to be talking about climate change preparedness. This is an issue that a lot of people have to think about really hard, to wonder what they can possibly do to prepare for that. Well, it's all right, because the CDC's actually got ways for us to be prepared through our local government, our local public health departments, and we're going to talk a little bit about that. I have Gino Marinucci. Did I get your last name right?
Yes.
Okay, great. Gino, you're from the CDC, and the CDC actually has a preparedness program dealing with helping systems become ready for climate change. You tell us a little bit about that?
Yeah, we have the Climate and Health Program. It's still a relatively new program. It's only been around since 2009, but the aim of the program is to try to build the skills and capabilities in state and local health departments to be able to deal with climate change effects both now and in the future. So that's really our focus.
And so there's systems out there that have already received some grant money, and the program, and there's other grant money available. But this is really to help the local systems try to get ready for this. It's a big it's such a broad topic. I mean, what kind of things do people have to do to, when you talk about preparedness, what kind of things are you looking at helping systems prepare for?
Well, we've been giving out grant money since about 2010. We only have a very small pot of money. Like I said, it's a new program, and it's a new area for public health. So we've been giving out grants to 16 states and 2 city health departments to really do a lot of the trailblazing work to understand the climate projections and the climate science, and to be able to apply that in a traditional public health planning setting. So the types of things that we're working with our health departments that we're sponsoring to do is to really understand climate change projections and climate science, and to be able to interpret that, and to be able to plug that in to better understand how climate change will impact the drivers of public health within their counties and cities and state health departments. So it's really understanding climate change projections and being able to plug that in to longer range public health planning. So that's the other emphasis, is that we're trying to work with health departments to plan on much longer range than they've traditionally been doing.
And this is the Preparedness Summit, so it fits right in with that topic. And we have Matt Davis here from Oregon, and you are local health department there. You want to tell us a little bit about your local department, and you received some money through the state grant that came to Oregon down to your department, and tell us how you implemented that.
Sure, great. So I work at Multnomah County, which is in Portland, Oregon. And the state of Oregon received CDC money, and they turned around and subgranted 5 local health departments in Oregon with small pots of money to kind of walk through this BRACE framework to integrate some climate projections into our long-term planning. So the money allowed us at Multnomah County the kind of time and space to really learn about climate science and climate modeling, and get really clear about what climate change meant for Multnomah County specifically. And that's been really helpful, because it's allowed us to kind of provide a focus to our work, where before we were really broadly thinking about climate change and what it might mean, but by walking through the BRACE framework, we've really prioritized 3 areas for the health department to work on, and that's heat-related illness, specifically kind of what it'll mean to have more extreme heat days in the summer. Air quality problems that are related to climate change, so ground level ozone concentrations, and that leading to asthma and some other respiratory conditions. And then also changes to our vector populations, which are in Portland is mostly mosquitoes.
Okay.
So.
And all of that is affected by the change in the climate, and as it shifts, we see these populations of mosquitoes, for instance, shifting in their habitats farther north, so you deal with more of an issue and have a longer season for vector availability.
Yeah, exactly. It's kind of two-pronged. It's one, potential changes to the populations that we already have. So when the season starts, when the season ends, and then also nervous about species that are transported into the county, them having a greater likelihood of survival due to a kind of new climate conditions that we'll have. So.
Now, is this typical of what you're seeing the systems that are utilizing these grants coming up with these types of frameworks?
Yeah, the BRACE framework is the general guidance that our grantees are working with, and BRACE stands for Building Resilience Against Climate Effects. So, as I mentioned earlier, the philosophy is to try to ensure that health departments can access climate projections and climate science and be able to use that in a systematic way so that they can do more effective planning. So you can think of, there's a couple of features of BRACE. The first feature is that it incorporates climate change projections into public health planning. And previously that wasn't ever done by health departments. It was too complex and too difficult to understand that. And then the second feature is that the BRACE framework acts as a triage system. Climate change can be an overwhelming topic for a health department. So the BRACE framework walks health departments through a system where you can look at the big picture first, understand the climate change projections, and then you can start to understand the longer range health effects and try to get an estimate of the magnitude or the change in morbidity, mortality. So then you can start to prioritize which hazards you're worried about, and then look at the effectiveness data on what type of interventions are going to be most successful. So you can start to triage all of that and work out what interventions are going to be the most effective way for your city, county or state health department to start dealing with climate change.
And that really then trickles down to local hospitals, local practitioners to be able to be better prepared at that level to deal with their populations of patients that are going to be coming in. And it all starts at the local and state health department levels to really do that.
Yeah, there's certainly things that can be done at every tier, at every level, all the way down to the community. And by having a systematic approach to planning, you can actually make sure that everyone's on the same page. And you can really customize the hazards that you're concerned about, and really look at the localized data. So you're making sure that the way climate change is affecting your area is you're customizing your response to be in line with that. And that goes all the way down to all the different aspects of preparedness, community preparedness, hospital preparedness, and the like. So,
did you see that type of the basic level of framework adaptation in your system?
Yeah, I think one of the big benefits that we've had from BRACE, again, is the time to really understand what the climate models are saying about Multnomah County. And that's allowed us to work with our other kind of public health partners to think about what it's going to mean. So before you'd ask someone in the health department, what is climate change going to mean for your particular program, whether it's a clinic or preparedness. And they had a hard time answering because, like you said, it's such a kind of a broad issue. And out of kind of learning about climate modeling, we were able to zero in on a couple changes. So for us, it's going to mean we're going to have hotter, drier summers and warmer, wetter winters. And we could go back to the same partners we had previously engaged, but approach them with a more focused question. So what is it going to mean for you to have hotter, drier summers and maybe 3 heat waves where traditionally we've only had 1 per summer? And that's really empowered them to be able to think about, what is it going to mean for the communities we serve and for our own service delivery?
And you know the effects that those things have on your systems already, because you have those events that occur, so you can project the cost in real healthcare costs, as well as the cost in human disability and illness and effects to people's lives.
Yeah, absolutely. And a lot of the time, for us especially, it's been about an increase in frequency of events rather than new events. So you're right.
Yeah. Now, how far out? You said long-term planning. What does that mean? I mean, is that 5 years? Is that 10 years? Is that beyond?
So for us, we are the climate modeling that we've used. We're really lucky to have a state climatologist that's worked with us pretty extensively, and their models are really solid out to 2040, 2050, and that's kind of the target that the time bound that we've put on our planning. So.
Excellent. Is that pretty typical?
It is, but we're working with the National Climate Assessment, which is a national scale assessment of climate change for the US, and the National Climate Assessment actually has 3 future projection periods. It's looking at how the climate will look in 2035, I think 2055 and 2085.
Okay.
So we're encouraging health departments to look at the different timeframes, but obviously the further out you get, there is more uncertainty with that, and also it's you have to be realistic with the resources within a health department. How much, how accurate do you need to be in order to start to affect those resource allocation decisions? Is it a case of having an understanding of the scale of magnitude that will change, or do you really need to be quite accurate? And there's some variance in the opinion on that, but right now we're taking the philosophy, while it's still early, that the more accurate we can be, the better, and then we'll assess that as as the science and as the public health practice emerges, we'll try to pare that back and work out what the minimum amount of information that a health department needs to actually be able to effectively move forward and make these decisions.
Well, it's exciting, and it's good to hear that we're addressing this, because I really didn't think about this. Like you said, it's such a broad topic. I wasn't sure what we were going to be really talking about when I first looked at this topic, but it really makes sense for us to plan for this as healthcare professionals and public health departments to be ready for these changes that are coming. Where can people find out more information about this? Is this something they can look up at cdc.gov and look up the BRACE framework? Is
yeah, you
resource for them there?
You can go to cdc.gov/climate and health, and that's where the climate change and climate and health information is housed. It has information on the Climate Ready States and Cities Initiative. It has links to all of the participants within the Climate Ready States and Cities Initiative, the 16 states and 2 cities. There's also information about the BRACE framework, and there's some good links that we're updating each day, links to some of the climate change projections, but also links to some of the health effects information, some of the tools that health departments can actually use, communication tools, ability assessment tools, even how-to guides on how to project the disease burden. Some of those things we're still working on, and there'll be more and more tools and guidance that's coming online as we progress further forward. You know, it's still in its early days.
Excellent. Well, it's good to be part of that. What about you guys?
Yeah. So on our end, you can go to our website, which is multco.us. And in Multnomah County, in addition to engaging the other areas of the health department, we also developed a standalone climate adaptation plan as part of a city-county mandate. So you can look at our standalone plan, and then also at the State of Oregon's website, you can learn a little bit more about the process we used, as well as the process of the other 4 local health departments in Oregon.
And we'll make sure we have the links to all of that in the show notes so people can follow up on this information and dig into how they can be better prepared for climate change in the future for themselves and their systems.
Great.
Gino, Matt, thanks a lot for being on the show.
Thanks for having us.
Thank you.
Great. And I want to thank all of you for checking out this episode of the Disaster Podcast. I'm your host, Jamie Davis. We're here at the NACCHO Preparedness Summit in Atlanta, Georgia. We'll have more segments for you coming up soon here at the Preparedness Summit.